Welcome to NHS Barnsley Clinical Commissioning Group's annual general meeting 2016-17. We want to take this opportunity to showcase some of our best initiatives over the last 12 months and look a little closer at some of our key achievements from the last year. This year we introduced dementia-friendly GP practices. Each GP practice has a member of staff that takes on the role of dementia champion and leads the way to improve the experience of people living with dementia and their families and carers when they come to see the GP or nurse. The introduction of the clinical pharmacists into GP practices has extended the capacity of primary care teams, increasing access, reducing waiting times, and will enable more proactive, earlier interventions for wider numbers of patients.
Hi, my name is Patrick, and I'm a clinical pharmacist working in Barnsley. From my experience so far, I've been involved in the management of chronic cardiovascular disease conditions like hypertension. By having myself in practice, it frees up GP time to see more complex patients and increases the capacity of the GP surgeries.
I'm Dr. Ghani. I'm a GP partner at Neighbourhoods Medical Practice based in Cudworth. We've had Patrick as a clinical pharmacist for the best part of a year. With his knowledge and skills of drugs and disease areas, he's able to ensure that these drugs are safely prescribed, closer to home for patients, and if there are changes of medication, for whatever reason, Patrick is able to have that detailed conversation with patients and give them time to do that.
The vision for the people of Barnsley is that we have an integrated and joined up health and care system where patients don't see boundaries. They see recognisable faces, faces they can trust, faces that are connected. Through accountable care, we will deliver one system, no organisational boundaries, clear and collective leadership, strong public and patient involvement. Our goal is to dismantle boundaries so that patients don't see any of that at the point of delivery of care, to create a Barnsley where patients' interests are first and paramount, and we can truly get on and develop health and social care to put the people of Barnsley first. It's a wonderful opportunity for us to work with patients, put patients really at the centre and in control, and improve outcomes together. So let's do it together.
During 2016-17, the CCG has also funded ChiliPep to support the development and delivery of Barnsley's local area transformation plan under Future in Mind. As a key part of this work, ChiliPep has set up a mental health participation group known as Oasis for young people aged 11 to 25 wanting to help influence services and raise awareness about mental health in Barnsley. The group have received training around commissioning to enable them to act as young commissioners, as well as training around mental health and influencing change. GP practice managers have excellent working relationships. They meet regularly to discuss the varying needs of patients in Barnsley and how they can all work better together across the town to improve patient care.
There are national drives to bring primary care to work in bigger groups for the sustainability of primary care, particularly the GP practice element. So increasingly now we're looking at working together in groups, neighbourhood groups or locality groups. We've matched our locality groups to the area councils, the local authority groupings, so that we're coterminous with their patch to look at the needs of the population in that area and the service delivery that is required from general practice. There are opportunities to look at how we can pool our skills together and look to offer more local to where people live.
Neighbourhoods is about bringing together a wide range of services in local communities, or hubs. This way of working came to life with the introduction of the neighbourhood nursing teams, supporting out-of-hospital care, concentrating resources around our communities and bringing care closer to home. More services can be layered over these neighbourhoods, bringing together expertise, improving communication and enhancing joint working.
So back in 2015, when we started the work on the Community Nursing Review, we recognised early on that what we were seeking as much as anything was a cultural shift, and not just on the behalf of district nurses but also practices and practice nursing. We put together a proposal which Sheffield Hallam worked on with us to deliver a 2-day interactive course using an actor, creating safe rehearsal space to really ensure that they had the best start for the new service in terms of meeting each other to build their relationships, to then agree how best to work together to maximise their resource delivery to the patients of Barnsley.
The CCG invested in a social prescribing scheme, My Best Life, which offers support to local people for non-medical issues, but who often go to see their GP with social, emotional or practical needs where a prescription for medication doesn't help.
So hi, I'm Darren. I'm a social prescriber for My Best Life. But My Best Life is basically a project that helps the most vulnerable people in our society to flourish better. So not everybody's problems can be answered with medication. So there's other things that they might need. So they might be isolated, they might have a problem with debt. It can be a variety of other things, and so basically my role is to put the customer, client, patient in touch with these other services. So see me as a kind of like a glue. Robert was referred to me by the community matron who were really worried about him. He didn't know what to do with him. He'd helped him medically, but there were other things going off. He was really depressed, he was lonely, suffered really bad with anxiety. So I came round and I visited Robert, and he was in a bit of a bad way, to be honest.
Yeah, my name's Robert. I'm 57. This is what's left on it. Doing much. I've got COPD, I've got a bad spine, in and out of hospital with infections, and then started getting down. Depression. That's got another bad infection, and that's when Darren started coming to help. And he's helped me through it. Help that Darren's got for me, and you know, all these services coming round, it's what's got me back. If I didn't start looking after myself a bit better and start getting things sorted and accepting help, it were ending there.
I originally I just got to know him, and he's a really interesting person when you get to know him. He makes musical instruments, he's a mechanic, really good with his hands, he's been on stage, he's done all sorts. So we got talking to him, and then a key thing was he was lonely. I also contacted social services and got them to come in 4 times a day because he wasn't eating, he was struggling just with day-to-day life, so they've come in, they've done a great job. He's come a long way, he's come a hell of a long way, to be fair, and I'm so proud of him, and he's a joy to work with because he knew he needed that help. He didn't know where to go for that help, and luckily he got put in touch with our service, and it's made a big difference to his life.
The CCG's budget for 2016-17 was £404,651,000. If our budget was represented as £1, this is how it was spent. Hospitals and transport, 50p. Prescribing, 12p. Primary care, 10p. Community, 9p. Mental health, 8p. Continuing healthcare, 4p. Running costs, 1p. Other programme costs, 6p. Here is our expenditure with our biggest providers. Barnsley Hospital, £137.1 million. South West Yorkshire Partnership Trust, £67 million. Sheffield Teaching Hospitals, £25.4 million. Rotherham Hospital, £11.7 million. Yorkshire Ambulance Service, £9 million. Doncaster and Bassetlaw Hospitals, £6.4 million. Thanks for coming along. You can find more information in our annual report. Please feel free to ask our teams any more questions you might have today.